Hi everyone, I'm Dr. Samit Unadkat, a consultant ENT and facial plastic surgeon, and today I'm going to be joined by Thakrar, Dr. Thakrar, who is a cosmetic dentist, and I thought we'd touch on some of the common ground, the pitfalls, the challenges that we experience within our respective fields. As you may know, within dentistry and with facial plastic surgery, increasingly there's a trend to go overseas. Not always for the wrong reasons. Often the reasons are very, very justified. But I thought we'd get a perspective both from a dental and a facial plastic surgery point of view. So, Jinesh, thank you very much for coming and speaking with us.
Thank you very much for having me. I'm very excited about this.
So, Jinesh, what have you been seeing with regards to the trend in cosmetic dentistry? I know you do a lot of it here within the UK, but do you get, for example, patients coming to you exploring options abroad?
Yeah, I mean, I think it's become quite a trendy thing to have your teeth done now, especially with social media and influencers and the whole marketing side of things. Patients are constantly bombarded on their feeds with people having their teeth done or perfectly looking. So I think, we are faced with patients who are in a dilemma of wanting to improve their smile or their appearance, and they are looking for options, and they will look in the UK, but they will also go abroad and see alternative options, often because they are cheaper.
In your experience, is the quality of work good overseas? Is it variable? I mean, what's your take on it?
I mean, in all honesty, I think it's quite varied. I've seen some work come back, and I'm actually been pretty amazed by what we've seen. And often it's a case of, there's bad connotations associated with going abroad, and that's not always the case. But on the whole, the majority of the times I see work that's not planned correctly, or teeth that are over prepared, or teeth that aren't planned for longevity in mind.
Yeah, that's a really interesting point you make. It's something that I've certainly seen as well. I get a lot of my patients as well coming to me, having seen things on Instagram, trends on Instagram, and will say, "Oh, I've seen this particular type of nose being undertaken overseas. Can you deliver those type of results as well?" And sometimes you look at the result and think, "Wow, that's really quite impressive." And I'll always be quite transparent with them that, look, we have to always balance form with function, and what we want is a long-term stable result that fits their face. So it's important to understand, I think, patients' expectations. But no, I agree entirely with you. If you do your due diligence, there are some excellent surgeons overseas. There are good surgeons everywhere, and there are perhaps slightly less experienced surgeons. And I think, in your experience, what sort of things should patients be looking for when deciding whether or not to have their treatment, their teeth treated here in the UK versus overseas?
I think it's with anything that you're making a big investment in, you want to be doing your due diligence. So you want to be looking at the credibility of the clinic and the dentist, whether you're looking abroad or in the UK. Look at their before and after photos. Keep an eye out. Are they looking overly edited? Are all the cases looking very similar? Is there something that doesn't quite fit or look right? Are they promising lots of other things as part of the package to try and make it more enticing? Because often when you are investing in yourself, or trying to make a change in how you look, there has to be some value in what you're going to get, and often there's an emotional aspect to that. But often what these places abroad may be doing is packaging that value with convenience. So what they're putting in that is a convenient flight, a luxury hotel. So they're marketing your ability to get a change, but also have other things packaged with it. And so it's being mindful. Are things being put in there just for the sake of adding value, or is it actually you're going to get the end result that you want? Second of all is, what does the consultation process look like? So often we've found when people go abroad that it's a very quick email conversation, and they've already diagnosed or told you what you're going to get, or they ask you to select between a few different materials, for example. And, for the lay person to know what type of material to use, often many dentists don't even know what different materials are out there. There's hundreds of thousands of different materials. You can buy stuff off Alibaba if you wanted to. So, it's making those, having being sort of mindful of the consultation process and being wary of, a quick decision or a quick plan that's being made. Are there thorough checks being done? And look at the regulations in that country and the general credibility of the dentist that's treating you. Are they a world-renowned speaker? Because there are many dentists, or I'm sure, surgeons as well, that are world-renowned and have spoken at big conferences or have a name for themselves, are leaders in their field. And keep an eye out for that. Or is it somebody that's ill-experienced and is not going to be able to provide you with the result that's going to last long? And as you said, form and function as well.
Yeah, I totally agree. I think form and function have to always be balanced. And certainly one of the things that I come across from patients is they look for trends. If patients come to me, and actually, if I'm completely honest with you, many of them don't come to me for that reason, is if they are looking for a particular type of cookie cutter rhinoplasty nose job, I'm not that surgeon for them, because I'm not going to be able to deliver it, nor do I necessarily always agree with it. I think we have to try and get the best out of that patient's anatomy. We want to do the best by them. So I always say to my own patients that if you are looking for a more bespoke type of approach, that's the sort of thing that certainly me, maybe some of my colleagues would perhaps specialize in, and those that are overseas maybe. And I'm not, it's not true for everyone across the board, of course, but they may have a particular style, a particular type of rhinoplasty that they deliver. And I always go back to them and say, just check the credentials, check their experience. How many rhinoplasties are they doing? What is the comeback if there is a problem? Which, let's be honest, everyone will have slightly imperfect results.
Of course.
So then what is the follow-up process? Is there a charge for revision surgery, as an example? These are the questions that you need to be asking. Then what about regulations? What type of setup is in place? How are they going to be followed up? Because I often find that one of the most difficult aspects of rhinoplasty surgery, it takes about a year to see the final result. Swelling takes a few months initially, and then will gradually get better over a period of 1 year. So often it's quite impractical to be going backwards and forwards overseas to see that surgeon. So often for the sake of, I guess, saving a few pounds, you lose out on the aftercare process. And for me, that's would be hugely important. But equally, price is clearly a factor for many patients. So it's important just to do your research beforehand.
I think, 100%. And I think the aftercare is probably one of the most important parts of any of these procedures. It's not like having, for example, even your kitchen done often where there's very little aftercare. This is your health and it's your body. And so, as you said, things are not always going to go 100% correct. There may be certain revisions or things that need to be tweaked, or with every medical procedure, there's always certain risks. And what's going to happen if you are one of those people where, unfortunately, one of those risks, comes into play in your case? And are you going to be looked after? Is it going to be an inconvenient flight? And as we know, most issues tend to happen on a bank holiday or just before that important wedding. So as you mentioned, I think the aftercare is super important in looking at, and what sort of follow-up do they have. But I wonder what it's like in your case, because when I look at these websites of places abroad, they often say lifetime warranty. And I know from a dental perspective, and I can guarantee you this across the board, nothing any dentist will put in anybody's mouth will last forever. However good of a dentist you are, it's never going to last forever. And I always like to explain that to patients, that it will always at some point need replacing. Now, when it comes to replacing it, are we going to have enough tooth structure, for example, to be able to redo the same thing again and give you a result that's going to last you another 10 to 15 years? So, I mean, do you find that same sort of, I guess, guarantee given to patients that they're going to have something that's going to last forever, or, going to be a long-lasting thing?
Similar to what you're saying, we have to factor in the natural aging process. As we all get older, and it's something I've written about quite extensively, about the aging face and the aging nose. As we get older, unfortunately, like most things, things tend to go south. The ligament laxity tends to weaken. You tend to have a bit more deposition of sort of fatty tissue within the nose. The natural musculature tends to weaken. And so whilst we aim for strong, stable, long-term results, we have to also be realistic. There are skin changes. There are going to be aging parts of the face. So no, I don't think anyone would say we want a lifetime guarantee of the result. But equally, we would be hoping for a very long-lasting, stable result. And again, it goes back to my earlier point of maintaining function as well as the aesthetics of the nose.
100%. And I think one of the things that you touched on, and I think it's becoming more apparent within dentistry now, but it's probably more, prevalent in your case, is facially driven aesthetics and facially driven planning. And traditionally, or a lot of times, people will just hone in from our side of things on the mouth and not look at how that fits into the rest of the facial features. Whereas now it's becoming more of a thing, and the way that I like to plan cases is with the whole facial structure and looking at a person's personality, facial features. And so, do you find some of these abroad clinics will be doing that, or is it a lot of it is just a copy and paste, give you the nose that that we're going to give everybody, and not think about longevity and the person themselves?
I couldn't agree more. One of the patients I had quite recently actually said, I want this particular type of nose. This particular surgeon overseas can deliver this every single time. And I say to him, no problem. That's not something that I can personally deliver. And we shook hands, and that was the end, pretty much. Because you have to be honest and transparent that I'm not going to be able to deliver that. Equally, you look at the patient's face as a whole, and there are certain key features that we look for, angles that we measure. It's a full photo analysis of that patient's face to see what sort of nose would suit them, and also taking into consideration their own viewpoints. Now, here, this is an interesting one. I would say even going back 5, maybe 10 years ago, patients always wanted a particular type of nose, shall we say. And a lot of my patients, if they have a hump on their nose, they want it completely reduced, a slight upturn at the tip, particularly in more female patients. But lately I've seen a slight trend where almost patients would prefer to have a more natural, more bespoke, almost to keep a degree of imperfection.
Yeah.
Have you seen that?
100%. I think we've had this weird trend, whereas if I look back where cosmetic dentistry started, it was initially in Hollywood. The cosmetic, the bright white veneer smile, because it was a sign of, wealth, and I could afford that. And then it became more accessible because more clinics were providing it, costs came down. And so therefore everybody was then getting it, and it then just became everybody was getting a very similar look. And now I think there's just a general trend in going around of having things that are enhanced but looking a bit more natural, so they don't look like too much stuff is done. So now we are designing veneers and planning our composite bonding with lots of texture inside them, minor imperfections, so there's still symmetry there, but enough that it looks natural and it looks like your own teeth. So somebody would know, when somebody has their teeth done, we don't want them to get the response like, oh my God, your teeth are, bright white and they're staring at me. It's like, it's something different, or, you look a little bit fresher. Have you lost a bit of weight, or have you gone to the gym, or, something's changed, but not like, I know it's your teeth. And that's what the result that we're looking to get. And I think that comes down to making things look really natural. That comes down to the new materials that we have, but it's the experience of the clinician knowing how to make that look natural in somebody else's face. And I think often if somebody's going abroad, somebody's going abroad and they are going for a short trip and they're going to have a procedure done, are they having the time to make sure everything is going to be suitable for their face? And often when we provide veneers for a patient, for example, it's done over multiple appointments, and we have a review appointment of their trial smile, essentially. So an appointment to review how the veneers will look in their face. And that's allowed them to get used to the change, us to kind of objectively look at the teeth and say, look, this can be a little bit different. We can adjust this here. And then we use that to go to our final plan. Often if you're going abroad, they're doing some of these things in a day. How are you then going to make a decision in a day about how you want your teeth to look? Are you happy with it? Is it the length that you're happy with? Have you got the opinions of your friends and family to say that suits you, it doesn't suit you? All of these things take time to get used to. And often we're changing people's bites as well. And so, that involves the musculature. That can lead to many other problems if that's not taken care of. So often we need a period of time to make sure that things are working well together. And if that's not, taken into account, or things are done very quickly, it's going to lead you with more problems later on down the line.
Really interesting you say that. So it's so, I see such an overlap between both our respective
100%.
fields. I see it all the time when patients ask me, what do you class as a good rhinoplasty? Or so-and-so's had such a nice rhinoplasty. And to me, that's if you can tell that the patient's had a rhinoplasty from afar, to me, that's not always a good sign.
I agree.
You almost want it to blend in to the rest of the face.
Yeah.
You don't want that to be a focal point. Either that's a heavily sculpted, arguably a very beautiful in isolation looking nose, but that doesn't fit the face, or a nose that perhaps is more imperfect, where they would be thinking, well, actually, I want to have a nose job. What you really want to do is have a nose which fits their own facial features, where that doesn't become the focal point.
Yeah.
Because if it does, to me, that's not, at least for my patients in the majority of cases, that's not what they're after. And that, for me, is a sign not necessarily of a great result.
No, I agree. And I think touching on some other sides, how do you think, from your experience, regulation differs from, the doctors and surgeons in the UK compared to some of those abroad? And how do you think that impacts patients?
Credentialing is big in the UK. And I think insurance safety, rightly, is at the forefront in Britain. I think regulations are stringent. So for anyone undertaking rhinoplasty surgery in the UK, you have to look at certain basic credentials. And that is, firstly, have they got the FRCS in either plastic surgery or ENT surgery? And by what do I mean by FRCS? It's a fellowship with the Royal College of Surgeons. It's to show that they have done their required training and have got, at the very least, they're on the specialist register for either ENT or plastic surgery. The second thing within the UK, you have credentialing. People, if they want to, now this is optional, will then go on to become certified in a particular area. So they may end up getting a board certification in facial plastic and reconstructive surgery. In order to be credentialed appropriately, it's a very quite stringent process where they have to look at the bare minimum of 100 cases over a 2-year period of facial plastic and reconstructive cases. Followed by, and they scrutinize your outcomes to say, okay, are these acceptable? Then you're deemed to be eligible to sit a written exam over 6 hours, followed by a further Viva verbal exam to go through cases. And you'll be examined by peers to see if you meet the certain standards.
Yeah, that's quite a rigorous process.
It's quite a rigorous process. And then I think it's important that, if you're a patient, you ask, how many rhinoplasties are you actually doing? What is your revision rates?
Yeah.
Etc. How much of the certainly in my case, rhinoplasty is the focus of your practice. There are many people who will dabble with a bit of general ENT or general nasal surgery or general plastic surgery, and are they experienced enough for that type of problem? So I've seen patients rightly are more discerning now. If they have a particular problem, they want to go to the person who is the best or who has extensive experience in a particular area.
Yeah.
And I'd say that's one of the strengths, certainly within the UK, that our regulations are stringent enough, whereby if there is a problem, then there's appropriate policies in place.
I think there's a safety net,
of course,
to some extent. And I guess abroad, not all countries follow that same level of, regulation.
Yeah, but it's important to caveat that. I think there are very good surgeons all around the world,
100%.
Very good dentists all around the world, in every place. But it's a case of making sure that you do your research in advance, making sure that you see their level of experience before, and checking the safety nets, as you mentioned, in place before just jumping the gun and going with a particular procedure.
I agree, and I think sometimes you can't discount clinicians abroad, doctors and surgeons abroad, because often, especially in some of these countries, they're more advanced in using different technology to us. So we're learning from them quite a lot. And often a lot of them are at the forefront of new developments, new technologies. And a lot of the dentists that I follow or have learned from or used as mentors are those from abroad, because they're adventurous and they're trying new things, and they're enhancing the profession and pushing it forward. So I agree, you definitely can't discount them. But often, even when I look at their prices, they're often more expensive than those in the UK because of their credibility and their credentials. So, I think going on the price alone can be a big problem? And have you found that patients are often having to spend a lot more coming back to revise things, or how do you think that impacts patients, from am I just saving a bit of money and getting my nose job done and having a nice holiday, to what's the long-term impact financially?
Well, I've got two scenarios here. I've had, I remember one particular patient came to see me, I think a week or two after rhinoplasty elsewhere, and was devastated, needed to have their plaster removed. They were advised to go and seek the opinion of a surgeon in the UK. And then when I examined them, they were in tears because they'd had part of their nose reduced from the side here, what we call an alar base reduction, which they hadn't consented for beforehand. But the surgeon had said to them when they woke up, well, it's my gift to you.
No.
It was never part of the plan beforehand.
That's crazy.
It was then when they did the sort of, I guess, the photomorphing, the 3D simulation, they'd opted to just modify the plan. Without any frank discussion. The patient was devastated. Nothing I could do, particularly a week, 2 weeks after surgery.
Of course.
And then the second thing we also sometimes struggle with is when patients do go overseas, say, for argument's sake, something doesn't quite go to plan. They then end up often in my NHS clinics. I still have an NHS practice.
Yeah.
And they'll turn up to my clinic saying they're unhappy with either the cosmesis or in some cases the functionality of the nose. That becomes quite a difficult ethical scenario
100%.
where you've got, and there is no right or wrong here, but if a patient has had a surgery overseas for cosmetic reasons, then comes back with breathing related problems, where does the buck stop?
Yeah.
What can we do safely on the NHS? I'm sure a lot of people would be up in arms at this and say, well, actually, they should have it done privately. If they had a private cosmetic procedure, which hasn't quite gone to plan, why should that be the remit of the NHS and the taxpayer to fix? But equally, they're struggling with their breathing, their sleep, their ability to exercise. So then that now becomes a health-related problem.
Yeah.
And that's often a really, really big challenge for us. And that's probably a topic for another day.
100%. I think it's quite a contentious issue, and obviously people will have lots of different opinions of it, especially where taxpayers' money will go and how patients are cared for afterwards. But even funny from an NHS dental perspective, as much as patients are looked after really well under the NHS dental services, but often the materials and the type of repair work that can be done under the NHS doesn't necessarily match what would be offered privately. So often patients are then, because they've tried to save money going abroad, are not able to get the repair work done, and therefore they're living with pain and discomfort because they've made this decision to go cheap, and actually spending a little bit of time doing their research could have saved them a lot of hassle and a lot of money in the long term. And actually, in fact, pain and discomfort, because of course financial aspects are important, but you're living with pain and discomfort on a daily basis then if you've had this problem. And I think, as you said, function is a massive issue for us. People having incorrect bite problems, pain, discomfort, swelling, in your case breathing problems, it leads people down it can lead to depression and all sorts of other problems.
Jin, we've touched on quite a lot of things here today.
Yeah.
Probably a bit more than I think we'd initially planned to speak about. But if I were just to summarize, if you were to give me your 3 main key take-home messages for a prospective patient looking for cosmetic dentistry, who may be looking overseas, may be looking within the UK, what would be your 3 key take-home messages?
I think number 1 would be to do your research on the clinician or the clinic. So have a look at their background, have a look at their credentials, have a look at their training, have a look at their before and after photos. I think the second would be the aftercare, and what sort of aftercare is offered. Is it going to be easy for you to access? It may be okay for some people and they feel comfortable taking a flight and going abroad to having the repair work done. But think to yourself, worst case scenario, if something happened at a time where I really needed to see somebody, would I be able to see them quickly? And are they accessible, and are they easy for me to contact again? So the third thing from a dental perspective would be, as I mentioned, not everything is going to last forever. In all honesty, no dentist would ever be able to give you anything that lasts forever. So when that comes to a point of needing redoing, is the work going to be done? Would the work have been done well in the first instance, that things can be still safely replaced and repaired going forwards to give you the longevity that you would want? So those are probably the 3 main things. Yeah. So yeah, I guess obviously, I mean, I know some of the points that I would have touched on would be quite similar, but are there any other key take-home points you think that patients would or should consider when considering cosmetic surgery, either in the UK or abroad?
No, I think you've touched on most of them. I think the key points for me would be number one, credentials. Look at their are they suitably trained in a particular procedure. Secondly, what proportion of their practice is dedicated to that procedure. I think the more you do, you want to be a master of one.
Yeah.
Rather than a jack of all trades, to use the old cliche. So I'd say, yeah, I think it's important to look at their credentials and look at their experience of that particular procedure. And the third thing I'd look at, what's their revision policy like? As I said, I think that there's not a surgeon in the world who always gets, shall we say, perfect results.
Of course.
Every single surgeon will have patients, hopefully a low proportion of patients, who will need a touch-up or a minor tweak or an adjustment or a revision procedure. What's the policy on that? So I think those would be my three key take-home messages for anyone looking for surgery within the UK or indeed overseas.
Yeah. I mean, the approach that I try to take with my consultations is it's important to build a rapport with the patient. Yeah. And I think during that consultation, it's important to really understand why the patient is undertaking the change that they want to make. And it's multifactorial, and it's to make sure that we're both the right fit for each other.
Yeah.
And I think, as you said, every dentist or every surgeon will have their own slight style to doing things and their own, I wouldn't say preferences, but their vision. It's like it's an art, isn't it?
Yes.
So, it's making sure that, does that vision suit what you want? Is it just, a cookie cutter? You're going to get, the same nose or the same teeth for every patient. So I think the consultation process and how much time is taken to really understand what you want, and then therefore you can see whether that's the right decision for you, rather than a quick Zoom call. Yeah, you can have all of your teeth done for $5,000.
Yeah, for us, it's a big part of it is, for me anyway, is making sure I have at least 2 consultations with every patient.
Yeah.
That's a non-negotiable from my end, because patients will come in, they may have seen 1, 2, 3, rightly, surgeons beforehand, making sure that they're doing their due diligence. And actually, I think that's a good thing that they've seen a couple of people beforehand, so that they know hopefully people are all saying the same things.
Yeah.
Regardless of whether they've seen other surgeons, for me, it's still important I see them twice. The first one is always to understand their views, understand their goals. Are we aligned in our shared vision?
Yeah.
We take photographs at that stage. Usually we undertake morphing. Then there's always a period I give them time to think about things.
Yeah.
I always then bring the patient back for a second consultation. Typically, it will be at least 2 weeks aside. There should be at least a gap of 2 weeks or so before I see them again, before we then say, okay, if this is something that you want to go ahead with, great, we can find a suitable date in the near future. Ultimately, cosmetic surgery, whether it's for the teeth or for the nose, by and large, is a luxury item.
Yeah.
It's not essential. There should never be any rush or pressure to undergo surgery. It can always wait. It can always wait 6 months, a year, even longer.
I agree. Yeah. And I think, and you probably have the same, we have lots of patients actually traveling from abroad to the UK to have their work done. And a lot of them are like, can I come in and have the work done on the day? Yeah. And I don't offer that. I say, look, obviously I'm not the right dentist for you if that's the case. We need to have a consultation first. And I think it's an important part of the consent process for a patient to have time to consider their options and understand fully what they are undertaking. Because, of course, there is going to be some health element to it by redoing a nose or redoing teeth, that you're going to change and improve form and function and the health and the longevity of the teeth. But at the same time, the patient needs to be fully aware and have time to consider those decisions. And especially when a big part of it is aesthetic, they need that time to go away and really consider the process. So, even for those patients coming from abroad, for myself, it's the same. There's always a consultation first before we undertake anything. And that's to make sure we're working from a good, stable base, or have a full understanding of what we're working with. And then we can make the correct treatment plan for them.
Jin, thanks very much for giving up your time. And this has actually been really insightful doing this. It's slightly different to what we've been doing so far.
Yeah.
But no, your insights are so valuable. And I think just seeing the I guess the similarities between our respective fields. Hopefully, the listeners find this to be quite beneficial and quite useful. So
Yeah.
thanks again for coming.
Thank you very much for your time. And I think, I guess in the UK, dentists and doctors are generally very well regulated, and it's reassuring to see that we have a very similar sort of thought process in terms of how we want to look after our patients and how we try to manage our patients. And same, it's been quite insightful to see it from a slightly different perspective, even though it's still aesthetic. To get your take on it and your input is highly valuable. So I appreciate your time too. Thank you.